Hello, my name is Brooke Ponting, and I did my signature assignment on heroin addiction. As you can see, this is the table of contents. We'll be going over the introduction, anatomy with diagrams, physiology, pathophysiology, diagnosis, treatments, and AI, demographics, and then my reference pages. Heroin is highly addictive. It's a drug processed from morphine. Naturally, it's extracted from the poppy seed, and it can come in white or brown powder, also a black tar-like substance, which is also known as black tar. Heroin can be injected, snorted, or smoked. Some clinical names are, apology if I don't pronounce them correct, but diacetylmorphine, diamorphine, and acetamorphine. Heroin can affect many organs, as you can see on the diagram on the left. However, I will just be covering the lungs, liver, and kidneys, and then also the brain, but that's in the next slide. So for the anatomy of the lungs, it has the apex, the base, 2 or 3 lobes, and then the surfaces. So with the apex, it's the blunt superior end of the lung. The base is the inferior surface of the lung, which sits on the diaphragm. And then the lobes, these are separated by fissures within the lung, and then surfaces, these correspond to the area of the thorax that they face. The anatomy of the liver, so the liver consists of 2 main lobes. Both are made up of 8 segments that consist of 1,000 lobules, and they're very small. These lobules are connected to small ducts that connect with larger ducts to form the common hepatic duct. And then for our kidneys, kidneys are bilateral bean-shaped organs, reddish brown in color, and are located in the posterior abdomen. In this portion, we'll be going over the mesolimbic dopamine system, which consists of the ventral tegmental area, the nucleus accumbens, the amygdala, and the hippocampus. So the mesolimbic system is a pathway. It's a neural pathway that transports dopamine from the ventral tegmental area to the nucleus accumbens, the amygdala, and the hippocampus. So the ventral tegmental area is in the midbrain, and it's crucial for reward processing, motivation, and addiction, containing dopamine, GABA, and glutamate neurons that project to various brain regions. The nucleus accumbens is located in the basal forebrain, between the caudate and the putamen. It has 2 components, the core and the shell. The core is the inner, more central portion, likely involved in motor functions, and the outer is a more superficial portion, plays a crucial role in the limbic system connections and reward processing. The amygdala is an almond-shaped group of nuclei located in the medial temporal lobe of the brain. It is part of the limbic system as well, which is involved in emotions, memory, and motivation. The hippocampus is a curved, elongated structure located in the medial temporal lobe of the brain. It is part of the limbic system, which is involved in emotions, memory, and learning. So for this portion, we'll be going over the physiology. So what is dopamine? Dopamine is a hormone and a type of neurotransmitter. It gives the feelings of pleasure and euphoria. It's all part of the mesolimbic system as well. So the mesolimbic pathway is a key part of the brain's reward system. Uh, dopaminergic pathway, it uses the neurotransmitter dopamine to transmit signals. Uh, dopaminergic pathway connects to the ventral tegmental area in the midbrain to the to the ventral striatum, which includes the nucleus accumbens and the olfactory tubercle in the forebrain. So when you experience like a rewarding event, dopamine is released in the brain's reward system. The endogenous dopamine, which is naturally produced in our body, acts on D1-like receptors in the striatum to decrease nigrostriatal dopamine release, which is a key pathway for motor control. This is a negative feedback loop because it helps maintain a stable level of dopamine and prevent overstimulation. So dopamine's negative feedback loop involves dopamine itself inhibiting the enzyme tyrosine hydroxylase, which is responsible for dopamine synthesis. This helps regulate dopamine levels and preventing overproduction. The amygdala is part of the limbic system. Like I said before, it's involved with processing emotions, particularly fear, anxiety, and aggression, and plays a role in emotional learning, memory, and behavior. Two major output pathways is the dorsal route via stria terminalis, which projects to the septal area of the hypothalamus, and the ventral route via the ventral amygdalofugal pathway, which terminates in the septal area, hypothalamus, and the medial dorsal thalamic nucleus. The hippocampus is part of the limbic system, involved in memory formation, spatial navigation, and emotional control. It converts short-term memories to long-term memories. The hippocampus processes information through key pathways, including the perforant path from the entorhinal cortex to the dentate gyrus, the mossy fiber pathway from the dentate gyrus to CA3, and the Schaefer collateral pathway from CA3 to CA1. The liver is a vital organ located in the upper right quadrant of the abdomen. It's crucial for metabolism, detoxification, bile production, and cholesterol homeostasis. The lungs are for ventilation, gas exchange, and protection, filtering and warming incoming air. It helps regulate blood pH as well. The major function, though, is gas exchange and requires blood from the pulmonary circulation. The blood supply contains deoxygenated blood and travels to the lungs where erythrocytes pick up oxygen to be transported. The kidneys, their excretion of waste products, regulation of fluids, and electrolyte balance. It has the production of the erythropoietin, which is a hormone to stimulate the production of red blood cells. It also helps regulate blood pressure. For the pathophysiology, heroin can activate the mesolimbic reward system, leading to dopamine release in the nucleus accumbens. This exerts its effects by binding to mu-opioid receptors, which are G-protein coupled receptors, leading to a variety of physiological effects, including analgesia, euphoria, and respiratory depression. Heroin addiction occurs when the brain's reward system is hijacked. Heroin addiction is linked to the mesolimbic system, where the opioid increases the dopamine levels in the nucleus accumbens. Chronic usage can lead to long-term changes in the mesolimbic dopamine system, like increased dopamine receptor sensitivity, which contribute to the development and maintenance of addiction. The nucleus accumbens is affected by heroin addiction by altering the dopamine signaling, structural and functional plasticity, and increases the vulnerability to relapse. The amygdala plays a crucial role in heroin addiction. There is a decrease in the gray matter, which alters connectivity. This can contribute to drug craving and dependence as well. The hippocampus undergoes changes like impaired cognitive function and increased vulnerability to relapses. It reduces the neurogenesis, so it decreases formation of new neurons and alters the synaptic plasticity as well. Heroin can disrupt the normal process of synaptic plasticity, including long-term potentiation and long-term depression. With additives like sugar, starch, and powdered milk inside heroin, this can cause clogging of our blood vessels that lead to the lungs, liver, and kidney. The lungs, heroin acts on opioid receptors in the brain, including those involved in regulating breathing. This can lead to slowing or suppression of breathing, a condition also known as respiratory depression. Heroin increases the likelihood of lung infections, pneumonia, and tuberculosis, because generally people that are addicted are not taking care of themselves. There's also fluid in the lungs known as pulmonary edema, or excess fluid buildup in the lungs, which can occur from heroin use, severely impairing oxygen exchange. The liver, chronic heroin use overburdens the liver, increasing the risk of conditions such as hepatitis and cirrhosis. Unsanitary sharing of needles and paraphernalia frequently leads to transmission of hepatitis B and C, both of which significantly harm liver function. The kidneys have a condition called rhabdomyolysis is due to chronic heroin usage and can lead to muscle breakdown, releasing harmful proteins into the bloodstream that strain the kidneys, and also heroin usage or abuse can lead to kidney failure, which is happens with prolonged use. It can result in permanent kidney damage or kidney failure due to dehydration, infection, or the increased workload on the organs. Also, I just wanted to touch on the heart, because the heart is another vital organ significantly affected by heroin addiction. Due to collapsed veins from long-term intravenous heroin use can lead to collapsed veins, making it difficult for blood to flow properly. Heart infections, sharing needles, or poor hygiene during injection increases the risk of heart infections like endocarditis, which involves inflammation of the heart's inner lining and valves. Irregular heartbeats. Heroin slows down bodily functions, potentially causing irregular heart rhythms, low blood pressure, and even cardiac arrest. I also made a list of immediate short-term effects. So when heroin, which is the opioid, enters the body, it's converted to morphine. You'll have a feeling of pleasurable rush, followed by a warm flushing of the skin, dry mouth, and a heavy feeling in the extremities, followed by possible nausea, vomiting, and severe itching. Most users become drowsy, have clouded mental function, heart function slows, and breathing is slowed as well. Some long-term effects Changes changes the physical and physiology of the brain, creates long-term imbalances in neuronal and hormonal systems, which is not easily reversed. Deterioration of the brain's white matter, impairing decision-making abilities, regulation of behavior, and response to stress. And then when people create a tolerance, they then have start creating a dependence and needing higher dosage, which could lead to overdose. Diagnosis, treatment, and AI. Diagnosing drug addiction requires a thorough evaluation, often includes an assessment by a psychiatrist, psychologist, or a licensed alcohol and drug counselor. Now, if someone has an overdose, they can use the opioid antagonist medication called naloxone, which quickly reverses an overdose by blocking the effects of opioids. It can restore normal breathing within 2 to 3 minutes in a person whose breath has slowed or even stopped. And again, this is used during an overdose. However, there are some medications to help people who are trying to get off of heroin. So medications developed to treat opioid use disorders work through the same opioid receptors as the addictive drug, but are safer and less likely to produce the harmful behaviors. So methadone is a slow-acting opioid agonist. Methadone is taken orally so that it reaches the brain slowly, dampening the high that occurs with other routes of administration while preventing withdrawal symptoms. It inhibits the NMDA receptor. Methadone dampens major excitatory pain pathway within the central nervous system. Compared to other opioids, methadone's effects on the NMDA inhibition may explain its improved analgesic efficiency and reduced opioid tolerance. Buprenorphine is a partial opioid agonist. Buprenorphine relieves drug cravings without producing the high or dangerous side effects of other opioids. It exhibits high affinity binding to the mu opioid receptors and slow dissociation kinetics. Naltrexone, it blocks the effect of the opioids and prevents opioid intoxication and physiological dependence on opioid users. This medication is the mu opioid receptor antagonist and also a weaker antagonist of the kappa and delta opioid receptors. It is not addictive or sedating and does not result in physical dependence. However, patients often have trouble complying with the treatment, so it has limited effectiveness. Along with medications, cognitive behavioral therapy and contingency management can prove to be effective. And contingency management, it uses a voucher-based system in which patients earn points based on negative drug tests, which they can exchange for items that encourage healthy living. For AI, studies have shown that blocking kappa opioid receptors may offer a promising pharmacological approach to treating opioid dependence. Discovering drugs that can block the activity of a protein such as the kappa opioid receptor can be long and expensive. So using AI tools can make it more efficient, but it can take months to screen billions of chemical compounds. So using the AI artificial intelligence will optimize this process. For my demographics, in the US, as you can see on the right side, however, I'm kind of blocking it, but you you can see that for heroin, the usage has gone down, and this is due to a high increase in fentanyl use. So, not as many users anymore. So, approximately 7% of all opioid overdose deaths in 2022 involved heroin. From 2021 to 2022, the heroin overdose death rate decreased nearly 36%, and that's due to the rise in fentanyl. 2021, approximately 9,173 people died from an overdose involving heroin. Among people aged 12 or older in 2021, 0.4%, or about 1.1 million people, reported using heroin in the past 12 months. And I'm not sure why, but there really was not a lot of credible statistics out there for heroin overdose and mortality rates outside of the United States. However, I did find an article that was credible, talking about the Russian Federation and how it is estimated to be the country with the highest national level of consumption of heroin, with 70 metric tons of heroin consumed per year. And you can see on the left, it is in 2008 though, and that was the last statistics I was able to find. And that concludes my presentation on heroin addiction. And as you can see, this is a list of my references. Thank you so much.